Good morning, and thank you for being here today. I'm going to share evidence that reveals why PETA is calling on the Department of Health and Human Services to end the importation of monkeys into the U.S. laboratories. The CDC's own data show that tuberculosis-infected monkeys imported from Southeast Asia and Mauritius made it through federal quarantine and into U.S. laboratories, carrying multiple strains of TB, including a strain that we have never seen before here in animals. A new peer-reviewed CDC paper, quietly published behind a paywall, confirms this. Tuberculosis sickens 10 million people and kills 1.25 of them every year. It's the world's leading cause of death from a single infectious agent, according to the World Health Organization. This deadly disease is coming into the U.S. and, ironically, going into the laboratories that are supposed to be curing diseases. Now, TB is not just a monkey disease, TB is not just a human disease. Monkeys are bridge hosts, capable of cross-species transmission, shedding the mycobacteria through their breath, their saliva, their urine, their feces. Every infected monkey flown into the U.S. threatens not only expose humans, but also cattle, other domestic animals, and even wildlife, magnifying the danger far beyond the confines of the laboratories. The CDC claimed that between 2013 and 2020, virtually no TB-infected monkeys entered U.S. quarantine. But between 2021 and 2024, their own data showed that 69 infected monkeys arrived on 17 separate shipments. Each year, the number of shipments increased with infected animals. Even worse, the CDC's quarantine missed nearly 1 in 5 infected monkeys. Half of those missed animals came from shipments where another monkey had already tested positive. You don't need to be an epidemiologist to see the recklessness of this. So here's the picture. Hundreds of monkeys packed in wooden crate, diseased, distressed, flown from Southeast Asia or Mauritius, countries that the CDC admits have lax biosecurity. Some test positive in U.S. quarantine. And still, the CDC clears the rest of the shipment and releases those animals. Between 2021 and 2024, this happened again and again. So what happens next? In some cases, monkeys cleared from quarantine were diagnosed 27 months later with the same strain that had already been detected in their original shipment. In other cases, new strains surfaced months down the line. And in many cases, no strain data were reported at all, meaning we have no idea what type of mycobacteria tuberculosis those animals were carrying. The implication is unavoidable. The CDC knowingly releases thousands of imported monkeys that had been exposed to TB during quarantine. And by releasing exposed monkeys, the CDC seeded reservoirs of TB in laboratories and breeding facilities across the nation that house tens of thousands of additional monkeys. And it does not stop there. States that house monkeys are kept in the dark because there is no requirement to report post-quarantine TB cases to state officials. Everything relies on the voluntary reporting by importers. So in effect, the CDC has adopted a don't ask, don't tell policy for monkey tuberculosis. And finally, remember this. The study behind those findings covered 0.001% of the nearly 100,000 monkeys that were imported during that 2021 to 2024 period. The true scope of infection is almost certainly much larger. Ironically, the authors' papers bemoaned their lack of data and concluded that they could be more responsive to the public health impacts of failing to detect TB among imported monkeys during quarantine if they knew how frequently they were missing infections. This from the agency that is still clinging to an outdated tuberculosis skin test, a crude and notoriously insensitive tool that misses many infections. Worse still, the CDC's report, which is in your packet that we've shared with you, glosses over latent TB entirely and the testing blind spot that this creates. Despite that fact, the macaque monkeys, like humans, can carry the TB microbacteria silently for years before reactivating and shedding. By ignoring latency, overlooking apparently healthy monkeys, and relying on a centuries-old test, the CDC all but guaranteed that infected monkeys would slip through quarantine and into labs, creating a persistent source of infection that endangers workers, public health, and the integrity of the research itself for which these monkeys were brought into the US in the first place. Experimenting on monkeys is ineffective to begin with, but doing so on already sick animals guarantees failure. This isn't a testing lapse. It is a biosecurity crisis that should have shut down the pipeline years ago. CDC scientists confirmed 4 distinct strains of TB in just the handful of monkeys that they were made aware of. Evidence that this is not an isolated occurrence, but a sustained pathway for introduction and circulation of one of the world's most deadliest infections. Once inside US colonies, TB infections compromise research validity, they waste millions in taxpayer dollars, and have resulted in documented human exposures. This is an escalation of an issue that the CDC has failed to deal with for years. In 2019, during the period that the CDC had said no TB-infected monkeys are really coming in, the Oregon National Primate Research Center imported monkeys, which had been cleared by the CDC, but turned out to be latently infected, setting back projects that those animals were assigned to for years. A few years prior to that, at that same facility at the Oregon National Primate Research Center, they had a much larger outbreak of tuberculosis among imported monkeys. And in 2023, in Spain, smack dab in the middle of this surge in TB cases, monkeys imported from Vietnam passed screening in Spain, but were later confirmed TB positive. Vietnam, a known TB hotspot, was exporting monkeys to the US at the very same time. So across more than a decade, spanning continents, and the very supply chains feeding US labs, these cases reveal a systemic failure, not an anomaly. So why then does the CDC's limited and troubling data downplay the crisis, contradicting TB figures from another federal agency? In September of 2024, again, you'll see this in your packet, PETA filed a FOIA request with the USDA's National Veterinary Services Laboratories for all records of monkeys with imported TB between January 2023 and August 2024. The result? 96 TB-infected monkeys in just 18 months, a staggering figure that dwarfs what the CDC had admitted publicly in their study, which covered 48 months. When I asked the lead author of the CDC's new study about that gap, I didn't get data, I didn't get analysis, or even an attempt at an explanation. Instead, I was told to, quote, submit questions through the CDC's Division of Media Relations. When the CDC tells scientists to ask PR about a biosecurity gap, that is willful blindness. And that is why TB-infected monkeys are slipping into US labs. The CD has halted imports before. Rabies in dogs, Ebola restin in monkeys, monkeypox in rodents, even the threat of SARS from civets. But with TB in monkeys, they've left the door wide open. This isn't an unknown risk. Workers in primate labs have already been exposed. Some have been infected when TB slipped through quarantine. And unlike other pathogens that triggered decisive action, TB was allowed to keep circulating through monkey imports, creating a persistent biosecurity threat. And all of this risk serves no significant scientific purpose. The Food and Drug Administration does not require monkeys for drug testing or mandated safety studies. Their continued use is driven by habit, institutional inertia, and the industry's preference and profit, not by any legal or scientific mandate. Yet the US continues to import tens of thousands of monkeys each year from countries with documented tuberculosis problems, supplying pharmaceutical companies, contract research organizations, and even federal agencies like the National Institutes of Health and the Department of Defense. The corporations driving this trade, Charles River Laboratories, Worldwide Primates, Innovative, and Alpha Genesis Inc., are amongst the largest monkey importers. This is a pipeline built on willful blindness. The risks are known, the evidence is clear, and yet the imports continue. Stopping this threat means shutting down the international monkey importation line. PETA calls on the Department of Health and Human Services to end this crisis today by halting the imports of monkeys into U.S. laboratories. This isn't only about animal suffering. Though the cruelty in this trade, in this pipeline, is staggering, this is about national security. The CDC's own data prove the danger is real. Keeping the pipeline open is a choice, and one that this government can no longer justify. We must close our borders to disease. Thank you, and I'm happy to take any questions.